Click play, listen, memorize and repeat. Diuretics. Welcome to medications affecting urinary output. Indications for medications that affect urinary output include management of blood pressure, excretion of edematous fluid related to heart failure, kidney and liver disease, and prevention of kidney failure. Medications include high-ceiling loop diuretics, thiazide diuretics, potassium-sparing diuretics, and osmotic diuretics. High-ceiling loop diuretics. Prototype medication. Furosemide. Other medications. Ethacrynic acid. Bumetanide. And torsemide. Pharmacological action include: high-ceiling loop diuretics work in the loop of Henle. Block reabsorption of sodium and chloride and prevent reabsorption of water. Causes extensive diuresis even with severe renal impairment. Therapeutic uses includes: high-ceiling loop diuretics are used when there is an emergent need for rapid mobilization of fluid. Pulmonary edema caused by heart failure. Conditions not responsive to other diuretics: edema caused by liver, cardiac, or kidney disease, or hypertension. Unlabeled use for hypercalcemia. Route of administration includes oral, intravenous, intramuscular. High-ceiling loop diuretics. Complications. Complications includes: dehydration, hyponatremia, hypochloremia. Nursing actions includes: assess/monitor for manifestations of dehydration, dry mouth, increased thirst, minimal urine output, and weight loss. Monitor electrolytes. Report urine output less than 30 ml per hour, stop medication and notify the provider. If headache or chest, calf, or pelvic pain occur, notify the provider. This can indicate thrombosis or embolism. Minimize the risk for dehydration by starting clients on low doses and monitoring daily weights. Complications include: hypotension. Nursing actions involves: monitor blood pressure. Advise clients to avoid sudden changes of position and arise slowly from lying down or sitting. Client education. Monitor for manifestations of postural hypotension, lightheadedness, dizziness. If these occur, sit or lie down. Complications can include: ototoxicity. Transient with furosemide and irreversible with ethacrynic acid. Nursing actions are: avoid use with other ototoxic medications. Aminoglycoside antibiotics, gentamicin. Client education. Notify the provider of tinnitus, which can indicate ototoxicity. Another complication is hypokalemia less than 3.5 milliequivalent per liter. Nursing actions are: monitor cardiac status and potassium levels. Report a decrease in potassium level of less than 3.5 milliequivalent per liter. Teach clients to consume high potassium foods, bananas, potatoes, dried fruits, nuts, spinach, citrus fruit. Teach clients manifestations of hypokalemia, nausea, vomiting, fatigue, leg cramps, and general weakness. Client education. Notify the provider of tinnitus, which can indicate ototoxicity. Other adverse effects includes: hyperglycemia, hyperuricemia, hypocalcemia, hypomagnesemia, decrease in HDL cholesterol levels, increase in LDL cholesterol levels. Nursing actions are: monitor blood glucose, uric acid, calcium, magnesium, and lipid levels. Report levels outside of the expected reference range. Client education consists of observing for manifestations of low magnesium levels, weakness, muscle twitching, tremors. Contraindications and precautions. Avoid using these medications during pregnancy unless absolutely required. Due to excessive diuresis, furosemide can decrease milk production in breastfeeding clients. Contraindicated in clients who have anuria, no urine output. Use cautiously in clients who have cardiovascular disease, diabetes mellitus, dehydration, electrolyte depletion, and gout. Use cautiously in clients taking digoxin, lithium, ototoxic medications, NSAIDs, or antihypertensives. Drug interactions. Digoxin toxicity causing ventricular dysrhythmias can occur in the presence of hypokalemia. Nursing actions includes monitoring cardiac status and potassium and digoxin levels. Using potassium-sparing diuretics often are used in conjunction with loop diuretics to reduce the risk of hypokalemia, and administering potassium supplements as prescribed by the provider. Concurrent use of antihypertensives can have additive hypotensive effect. Nursing actions include: monitor blood pressure. Lithium carbonate blood levels can increase with loop diuretics, which can lead to toxicity if hyponatremia occurs due to the loop diuretic. Nursing actions consist of monitoring lithium levels. Adjust dosage if needed. NSAIDs with furosemide decrease blood flow to the kidneys, which reduces the diuretic effect. Nursing actions include: watching for a decrease in the effectiveness of the diuretic resulting in a decrease in urine output. Nursing administration includes: obtain baseline data, including orthostatic blood pressure, weight, electrolytes, and location and extent of edema. Weigh clients at the same time each day with same amount of clothing and bed linen, if using a bed scale, usually upon awakening. Monitor blood pressure and I&O. Avoid administering the medication late in the day to prevent nocturia. Usual dosing time is 0800 and 1400. Administer furosemide orally, intramuscular, intravenous bolus dose, or continuous intravenous infusion. Infuse intravenous doses at 20 mg per minute or slower to avoid abrupt hypotension and hypovolemia. If potassium level drops below 3.5 milliequivalent per liter, monitor the ECG, and notify the provider because the client might require a potassium supplement. Client education are as follows. If the medication is used for hypertension, self-monitor blood pressure and weight by keeping a log. Get up slowly to minimize postural hypotension and monitor blood pressure, and assess for hypovolemia. If faintness or dizziness occurs, instruct clients to sit or lie down. Report significant weight loss, lightheadedness, dizziness, GI distress, or general weakness to the provider. These can indicate hypokalemia or hypovolemia. Consume foods high in potassium. If with diabetes, monitor for elevated blood glucose levels. Observe for manifestations of low magnesium levels, weakness, muscle twitching, tremors. Observe for manifestations of low calcium levels, muscle twitching, muscle cramps, tingling in hands and feet. Report manifestations of ototoxicity, tinnitus or hearing loss. Nursing evaluation of medication effectiveness. Depending on therapeutic intent, effectiveness is evidenced by the following: decrease in pulmonary or peripheral edema, weight loss, decrease in blood pressure, increase in urine output, and decrease in calcium level. Client education. If the medication is used for hypertension, self-monitor blood pressure and weight by keeping a log. Get up slowly to minimize postural hypotension and monitor blood pressure, and assess for hypovolemia. If faintness or dizziness occurs, instruct clients to sit or lie down. Report significant weight loss, lightheadedness, dizziness, GI distress, or general weakness to the provider. These can indicate hypokalemia or hypovolemia. Consume foods high in potassium. If with diabetes, monitor for elevated blood glucose levels. Observe for manifestations of low magnesium levels, weakness, muscle twitching, tremors. Observe for manifestations of low calcium levels, muscle twitching, muscle cramps, tingling in hands and feet. Report manifestations of ototoxicity, tinnitus or hearing loss. Thiazide diuretics. Prototype medication. Hydrochlorothiazide. Other medications. Chlorothiazide, methylclothiazide, thiazide-type diuretics, indapamide, chlorthalidone, metolazone. Pharmacological action. Thiazide diuretics work in the early distal convoluted tubule. Blocks the reabsorption of sodium and chloride, and prevents the reabsorption of water at this site. Promotes diuresis when renal function is not impaired. Therapeutic uses. Thiazide diuretics are often the medication of first choice for essential hypertension. These medications are used for edema of mild to moderate heart failure and liver and kidney disease. Thiazide diuretics often are used in combination with antihypertensive agents for blood pressure control. These medications are used to reduce urine production in clients who have diabetes insipidus. These medications promote reabsorption of calcium and can reduce the risk for postmenopausal osteoporosis. Complications include dehydration and hyponatremia. Nursing actions are: assess and monitor clients for manifestations of dehydration. Dry mouth, increased thirst, minimal urine output, weight loss. Monitor electrolytes and weight. And report urine output less than 30 milliliters per hour. Stop medication. And notify the provider. Another complications of thiazides includes hypokalemia and hypochloremia. Nursing actions consists of: monitor cardiac status and potassium levels, especially if taking digoxin. Report a decrease in potassium level, less than 3.5 milliequivalent per liter. Client education. Consume foods high in potassium. Recognize manifestations of hypokalemia, nausea/vomiting, general weakness, fatigue, leg cramps. Complications. Hyperglycemia. Nursing action. Monitor for an increase in blood glucose levels. And other complications of thiazides includes hyperuricemia, hypomagnesemia, and increased lipids. Nursing actions. Monitor uric acid, magnesium, total HDL, LDL cholesterol levels, and triglycerides. Client education. Observe for manifestations of low magnesium levels, weakness, muscle twitching, tremors. Contraindications and precautions. Avoid during pregnancy because the medication decreases maternal blood volume and placental perfusion, reducing nutrients supplied to the fetus. If a thiazide diuretic is indicated during lactation, advise clients not to breastfeed because the diuretic enters the milk and is harmful to the infant. Contraindicated in clients who have renal impairment. Use cautiously in clients who have cardiovascular disease, diabetes mellitus, hypokalemia, hyperlipidemia, hypomagnesemia, and gout. Use cautiously in clients taking digoxin, lithium, or antihypertensives. Drug interactions. Medication and food interactions are the same as for loop diuretic medication. Digoxin toxicity causing ventricular dysrhythmias can occur in the presence of hypokalemia. Nursing actions includes monitor cardiac status and potassium and digoxin levels. Potassium-sparing diuretics often are used in conjunction with loop diuretics to reduce the risk of hypokalemia. And administer potassium supplements as prescribed by the provider. Concurrent use of antihypertensives can have additive hypotensive effect. Nursing actions. Monitor blood pressure. Lithium carbonate blood levels can increase, which can lead to toxicity, if hyponatremia occurs due to the loop diuretic. Nursing actions. Monitor lithium levels. Adjust dosage if needed. NSAIDs with furosemide decrease blood flow to the kidneys, which reduces the diuretic effect. Nursing actions. Watch for a decrease in the effectiveness of the diuretic, a decrease in urine output. Thiazide diuretics cause no risk of hearing loss and can be combined with ototoxic medications. Nursing administrations. Chlorothiazide is administered orally and intravenously, all others are given orally. Obtain baseline data, orthostatic blood pressure, weight, electrolytes, and location and extent of edema. Monitor potassium levels. Alternate day dosing can decrease electrolyte imbalances. Weigh clients at the same time each day with same amount of clothing and bed linen, if using a bed scale, usually upon awakening. Monitor blood pressure and INO. If potassium level drops below 3.5 milliequivalent per liter, monitor ECG, and notify the provider because the client might require a potassium supplement. Advise clients to get up slowly to minimize postural hypotension, monitor blood pressure, and assess for hypovolemia. If faintness or dizziness occurs, instruct clients to sit or lie down. Client education. Take the medication first thing in the morning. If twice-a-day dosing is prescribed, be sure the second dose is taken by 1400 to prevent nocturia. Consume foods high in potassium and maintain adequate fluid intake, 1,500 milliliters per day, unless contraindicated. If GI upset occurs, take the medication with or after meals. If the medication is used for hypertension, self-monitor blood pressure and weight by keeping a log. Report significant weight loss, lightheadedness, dizziness, GI distress, or general weakness to the provider. These can indicate hypokalemia or hypovolemia. If with diabetes, monitor for elevated blood glucose levels. Observe for manifestations of low magnesium levels, weakness, muscle twitching, and tremors. Nursing evaluation of medication effectiveness. Depending on therapeutic intent, effectiveness is evidenced by the following: decrease in blood pressure, decrease in edema, increase in urine output, reduced urine output in diabetes insipidus, preserved bone integrity in postmenopausal clients. Potassium-sparing diuretics. Prototype medication. Spironolactone. Other medications. Triamterene. Amiloride. Expected pharmacological action. Potassium-sparing diuretics block the action of aldosterone, sodium and water retention, which results in potassium retention and the excretion of sodium and water. Therapeutic uses. Potassium-sparing diuretics are combined with other diuretics, loop and thiazide diuretics, for potassium-sparing effects to treat hypertension and edema. Administered for heart failure. Potassium-sparing diuretics block actions of aldosterone in primary hyperaldosteronism by retaining potassium and increasing sodium excretion, causing an opposite effect of the action of aldosterone in the distal nephrons. Therapeutic effects can take 12 to 48 hours. Complications of potassium-sparing diuretics include hyperkalemia. Nursing actions. Monitor potassium level. Initiate cardiac monitoring for blood potassium greater than 5 milliequivalent/L. Monitor electrolytes and for manifestations of hyperkalemia, weakness, fatigue, dyspnea, and dysrhythmias. Treat hyperkalemia by discontinuing medication and restricting potassium in the diet. If needed, administer a potassium-excreting diuretic, or administer glucose and insulin intravenously to drive potassium back into the cell. Do not administer potassium supplements or other potassium-sparing diuretics in conjunction with spironolactone. Caution is recommended when administered with angiotensin-converting enzyme, ACE, inhibitors, angiotensin receptor blockers, and direct renin inhibitors because these can cause elevated potassium levels. Another complications of potassium-sparing diuretics are endocrine effects. These includes deepened voice, impotence, irregularities of menstrual cycle, gynecomastia, Hirsutism. Client education. Observe for adverse effects. Notify the provider if these responses occur. Another complications of potassium-sparing diuretics includes drowsiness, metabolic acidosis. Nursing actions. Monitor for metabolic acidosis, drowsiness, and restlessness. Client education. Avoid activities that require alertness until effects of medication are known. Nursing administration. Obtain baseline data. Weigh clients at the same time each day with same amount of clothing and bed linen, if using a bed scale, usually upon awakening. Monitor blood pressure and INO. Monitor ECG periodically. Monitor potassium levels. Nursing evaluation of medication effectiveness. Depending on therapeutic intent, effectiveness is evidenced by the following. Maintenance of expected potassium levels, 3.5 to 5.0 milliequivalent/L. Weight loss. Decrease in blood pressure and edema. Osmotic diuretics. Prototype medication. Mannitol. Pharmacological action. Osmotic diuretics reduce intracranial pressure and intraocular pressure by raising serum osmolality and drawing fluid back into the vascular and extravascular space. Therapeutic uses. Prevents kidney failure in specific situations, hypovolemic shock and severe hypotension, because mannitol is not reabsorbed and remains in the nephron, drawing off water, thus preserving urine flow and preventing kidney failure. Decreases intracranial pressure, ICP, caused by cerebral edema by drawing off fluid from the brain into the bloodstream. Decreases intraocular pressure by drawing ocular fluid into the bloodstream. Promotes sodium retention and water excretion in clients who have hyponatremia and fluid volume excess. Administered for the oliguria phase of acute kidney injury. Complications of osmotic diuretics are heart failure, pulmonary edema. Nursing actions. If manifestations of heart failure develop, dyspnea, weakness, fatigue, distended neck veins, and/or weight gain, stop the medication immediately, and notify the provider. Complications of osmotic diuretics include rebound, increased intracranial pressure. Nursing actions. Monitor for increased ICP, change in level of consciousness, change in pupils, headache, nausea, and vomiting. Another complications of osmotic diuretics includes fluid and electrolyte imbalances and metabolic acidosis. Nursing actions. Monitor laboratory values. Monitor for manifestations of metabolic acidosis, drowsiness and restlessness. Contraindications / precautions for osmotic diuretics. This medication is contraindicated in clients who have active intracranial bleed, anuria, severe pulmonary edema, severe dehydration, and renal failure. Use extreme caution in clients who have heart failure, are pregnant or breastfeeding, renal insufficiency, and electrolyte imbalances. Mannitol is pregnancy risk category C. Lithium excretion through the kidneys is increased. Nursing actions. Monitor lithium levels. Increased risk for hypokalemia with cardiac glycosides. Nursing actions. Monitor potassium and ECG. Nursing administration. Administer mannitol by continuous intravenous infusion. To prevent administering microscopic crystals, use a filter needle when drawing from the vial and a filter in the intravenous tubing. Monitor daily weight, INO, and blood electrolytes. Monitor for manifestations of dehydration and increased edema. Obtain baseline data, orthostatic blood pressure, weight, electrolytes, location and extent of edema. Weigh clients at the same time each day with same amount of clothing and bed linen, if using a bed scale, usually upon awakening. Monitor blood pressure. If potassium level drops below 3.5 milliequivalent/L, monitor the ECG, and notify the provider because the client might require a potassium supplement. Monitor for increased ICP, change in level of consciousness, change in pupils, headache, nausea, and vomiting. Monitor for metabolic acidosis, drowsiness and restlessness. Client education. Get up slowly to minimize postural hypotension, monitor blood pressure, and assess for hypovolemia. If faintness or dizziness occurs, sit or lie down. Report significant weight loss, lightheadedness, dizziness, GI distress, or general weakness to the provider. These can indicate hypokalemia or hypovolemia. Nursing evaluation of medication effectiveness. Depending on therapeutic intent, effectiveness is evidenced by the following. Normal kidney function as demonstrated by urine output of at least 30 ml per hour. Blood creatinine 0.6 to 1.3 mg per deciliter for males and 0.5 to 1.1 mg per deciliter for females. BUN, levels 10 to 20 mg per deciliter. Decrease in intracranial pressure. Decrease in intraocular pressure. Complementary therapies. Taking ginkgo biloba with a thiazide diuretic can cause hypertension. Hypokalemia can occur after taking antihypertensives and consuming licorice. NCLEX questions. 1. A nursing is planning care for a client who is receiving furosemide intravenously for peripheral edema. Which of the following interventions should the nurse include in the plan of care? Select all that apply. A. Assess for tinnitus. B. Report urine output 50 ml per hour. C. Monitor blood potassium levels. D. Elevate the head of bed slowly before ambulation. E. Recommend eating a banana daily. Question 1 answers are A, C, D, and E. A. Correct. An adverse effect of furosemide is ototoxicity. Manifestations of tinnitus should be reported to the provider. B. A urine output of 50 ml per hour is within the expected reference range. A urine output less than 30 ml per hour is a manifestation of dehydration, and the provider should be notified. C. Correct. A decrease in blood potassium levels is an adverse effect of furosemide, and the provider should be notified. D. Correct. Slowly elevating the head of the bed will prevent the client from developing orthostatic hypotension, which is a manifestation of hypovolemia. E. Correct. A banana is high in potassium. Encourage the client to eat foods high in potassium to prevent hypokalemia. 2. A nurse is providing information to a client who has a new prescription for hydrochlorothiazide. Which of the following information should the nurse include? A. Take the medication with food. B. Plan to take the medication at bedtime. C. Expect increased swelling of the ankles. D. Fluid intake should be limited in the morning. Question 2 answer is A. Correct. The client should take hydrochlorothiazide with or after meals to prevent gastrointestinal upset. Answers B, C, and D are wrong because B. The client should take hydrochlorothiazide in the morning or no later than 1400, and not at bedtime, to prevent nocturia. C. The client should expect decreased swelling of the ankles and D. The client should maintain an adequate fluid intake, 1,500 milliliters, throughout the day unless contraindicated. 3. A nurse is monitoring a client who is receiving spironolactone. Which of the following findings should the nurse report to the provider? A. Blood sodium 144 milliequivalent per liter. B. Urine output 120 milliliters in 4 hours. C. Blood potassium 5.2 milliequivalent per liter. D. Blood pressure 140 over 90 millimeters of mercury. Question 3 answer is C. Blood potassium of 5.2 milliequivalent per liter indicates hyperkalemia. Because spironolactone causes potassium retention, withhold the medication and notify the provider. Answers A, B, and D are wrong because A. Blood sodium of 144 milliequivalent per liter is within the expected reference range. B. Urine output of 30 milliliters per hour or 120 milliliters in 4 hours is within the expected reference range. D. A blood pressure of 140/90 mm per mercury is within the expected reference range. 4. A nurse is caring for a client who has increased intracranial pressure and is receiving mannitol. Which of the following findings should the nurse report to the provider? A. Blood glucose 150 mg per deciliter. B. Urine output 40 ml per hour. C. Dyspnea. D. Bilateral equal pupil size. Question 4 answer is C. Dyspnea is a manifestation of heart failure, an adverse effect of mannitol. Stop the medication and notify the provider. Answers A, B, and D are wrong because A. This blood glucose is within the expected reference range. B. Urine output of 40 ml per HR is within the expected reference range. D. Bilateral equal pupil size is an expected finding and can indicate reduction in intracranial pressure. 5. A nurse is planning care for a client who has a new prescription for torsemide. The nurse should plan to monitor for which of the following conditions as potential adverse reactions of this medication? Select all that apply. A. Respiratory acidosis. B. Hypokalemia. C. Hypotension. D. Ototoxicity. E. Ventricular dysrhythmias. Question 5 answers are B, C, D, and E. B. Plan to monitor for hypokalemia, which is an adverse effect of a loop diuretic. C. Plan to monitor for hypotension. D. Plan to monitor the client for ototoxicity. E. Plan to monitor for ventricular dysrhythmias, which is a manifestation of hypokalemia, an adverse effect of torsemide. Answer A is wrong because you should plan to monitor for metabolic alkalosis.
Thank you very much for clicking. A special shout out to @Seer9397 for suggesting this video. So please like, share and subscribe if you haven't done so, and leave me a comment on how you are doing. Have a blessed day.
And also a shout out and thank you to @KaylaL8046 for your comment. I really appreciate it. I'm glad you find the videos helpful. Let me know what future video would you want me to create for you.